Start. Sorry for the delay, and hello everybody.
No, it's not a problem.
And at the last slide, you will have how to contact me and the company, and I hope to answer all of your questions. But if you have more questions in a few days or whenever, you can write me. Okay, let's start with the introduction. Both PLA, polylactic acid, and calcium hydroxyapatite are what we call slow absorption fillers, but actually they are not fillers, they are biostimulators. They depend on the patient's reaction for the clinical results. So the injector must know how to identify the changes that occur at different tissue layers to put the product in a way that optimizes the result. And that's why we say in all of the workshops that maybe the learning curve with this kind of products are a little longer compared with the fillers like hyaluronic acid. Polylactic acid is a strongly hydrophobic and biostimulatory, and it can cause a very powerful inflammatory response in tissues. The way it is metabolized is very well described in all of the papers. It is metabolized to lactic acid monomers and finally to carbon dioxide and water, with any kind of rests in the body of the patient. It's a synthetic polymer from alpha hydroxy acids family, and it is obtained by fermentation of the carbohydrates present in sources as corn or rice. Immunologically inert, biocompatible, and biodegradable, is not toxic and is not carcinogenic. It has been used for years in applications in medicine, such as absorbable suture threads, discs, screws, clips, and drug delivery devices. As the covalent ester bonds are broken, the lactic acid monomers are released to be metabolized in pyruvate and ultimately carbon dioxide and water. Okay, you have here in the slides the references. You can find all of this information developed. Let's go to the point. Lactic acid is a chiral molecule. Its molecular structure has two distinct and non-superimposable mirror images called optical isomers or enantiomers. To distinguish them, they are commonly called levo and dextro forms, depending on the direction in which they polarize the light. Those enantiomers can produce 4 different substances of polylactic acid: the dextropolylactic, the levopolylactic, a mixture of dextro and levo, that's what is Lenisna and Juveluc, and the meso-PLA acid. Only PLLA and PDLLA have been widely studied and have shown promising. Both levo polylactic acid and the mixture of dextro and levo come in the form of a lyophilized powder that requires reconstitution prior to injection, usually with sterile water for injection. It must be stored in powder form to avoid the hydrolysis. There are different commercial brands, and each one of them specifies in its technical sheet the volume of water to be used and the time in advance with which it must be done. In addition, they also differ in the excipient. Some of them have carboxymethylcellulose or mannitol. In the case of Juveluc and Lenisna, they have hyaluronic acid. And they also present small differences in the duration and in the temperature necessary to reach the melting point, which may be relevant when resolving potential complications. The product preparation protocol may be important to achieve a homogeneous suspension that allows the product to be used with a small gauge needle or cannula that does not clog easily. That means easier injection, okay? It can also reduce the occurrence of adverse effects, the most common of which, as maybe all of you know, maybe characteristic nodules, papules, and granulomas that may appear up to 12 months after injection.
Dr. Ernesto.
Yeah, but it's not just to.
Dr. Ernesto, I think you are in mute.
Yeah, please.
Can you hear me?
You're in mute, Dr. Ernesto.
You are in mute, Dr. Ernesto.
Yes, just to reactive the micro, please.
But someone has silenced me. If it was put in the screen. Okay, you have to mute the rest of the people, not me. Are you listening now?
Yes.
Yeah,
please
yeah,
go.
yeah.
Yeah, yes.
That's
And all of the time of the presentation, you are not listening me from the
No,
beginning.
it's
No,
over.
we were, don't worry.
Okay,
No,
sorry.
no.
Okay, let's continue. I'm sorry, but because this is strange. The Zoom is behaving strange. Okay, I was talking about the protocol of preparation of the product. That is important to have a good suspension that allows the product to be used with a small gauge needle and a small caliber of cannulas. And some studies have shown that the good preparation of the product can reduce the adverse effects. Okay, over the years, the volume in which the lyophilizate powder is suspended has increased, and thus the number of adverse effects has decreased. So the more volume, the less problems. It's supposed. Okay. And some studies has also considered that different suspensions can be used depending on the plane of injection. When it is put in the supraperiostum, so deep for facial contouring and improving proportions, it can be more concentrated. And when it is injected more superficial to give volume, firmness, and support, it should be more diluted. Later, we are going to explain what does it means. Okay, the story. I will be very quick in this slides because all of you know in 1999 the product new field was approved for use in Europe with levopolylactic acid with carboxymethylcellulose. It has a lot of problems with nodules and bumps and granulomas. It disappeared from the market and reappeared in 2004 under the name Sculptra. It was approved by the FDA to only to correct the lipoatrophy in HIV infected patients, and it was in 2009 that the approval was extended to aesthetic medicine applications in immunocompetent patients. In 2014, appeared a new product with the mixture of levo and dextropolylactic, and in 2020, two new products with PDLLA and non-cross-linked hyaluronic acid, but without carboxymethylcellulose, this is important, obtained the CE marking for use in Europe, but it has been used a lot of years before in South Korea. We'll show later the clinical studies. The mechanism of action of the polylactic acid is very well established. All of these studies I can share with you if you ask me by the email or by my phone. The conclusion is that the polylactic acid provides a volume compared with hyaluronic acid similar. In this study, they injected the nasolabial fold with one side of the face with hyaluronic acid and other side with polylactic acid, and the volume is similar. So we are always talking about collagen stimulation, but the polylactic acid gives volume, even with superior efficacy to the hyaluronic acid in younger patients, in contrast to the result shown in older patients. We usually are tending to inject collagen stimulators in older patients, but they are very, very good option in young patients. The PLA may be a good choice for correcting even nasolabial folds. And when we try to deep inside the differences between the levo polylactic acid and the mixture of dextro and levo polylactic acid, we can find that there are a lot of confusions, even in clinical studies, because in this study, biostimulatory effects of polydioxanone, polydextro and levolactic acid, supposedly what we are talking now, and polycaprolactone, they published this study and they received some weeks later a letter to the editor regarding this article, because the owners of not the owners, the clinical directors of the company that produced the polylactic acid, when they show the images, the microscopic images, they told the editors that that was not levopolylactic, that was PDLLA. Why? Because the difference is very clear at the microscopical images. The levopolylactic acid at the left of the slide is irregular, and it's like a broken glass structure. And the PDLLA, the Lenisna, for instance, has spherical microparticles, and the inside is porous. So the difference it has been not so clear until a few years ago. We had to study it in articles like this in clinical and experimental dermatology that shows us that PDLLA is safe and has non-inferior efficacy compared with hyaluronic acid to treat nasolabial folds and whatever. But there are some differences between PDLLA and PLLA. The more than the structure, the microscopical structure, there are small differences in the melting temperature and the degradation time. We'll develop this a little later. Sorry. Okay. The PDLLA microparticles are round and porous, and the chain is irregular with random distribution of dextro and levo polylactic acid. Okay, and this is a bioengineering article that shows us a lot of characteristics of PLLA, PDLLA, and PLGA, and they are similar materials with very, very minor differences. But these minor differences, what are? The melting temperature in the PDLLA in Lenisna is a little lower, so it's easier to dissolve in case of we need to dissolve,